Oh, sorry there. Yes, sir. You say.
Hello, hello, welcome. Welcome, thank you for joining. I can see the person watching me said hello. Unfortunately, I don't know who that is. Let me see. I'd like to acknowledge you. Thanks for joining. I'm so glad to see you. Happy holidays. How's everything going? I trust everything is going well. Okay, welcome. It's a beautiful Saturday afternoon here. It's not sunny. T Jazz bar. And now I know that when Tuju Ogundeji is watching, Buki Ogundeji is also somewhere there. And maybe TJ is there too. Welcome. Thanks for always joining. I can't thank you enough for your support. The Ogundejis, you guys are great. I love you. Thank you. So yes, okay. This is an interesting episode because this is going to be the last one for the year. I'm gonna spend some time with my family on Saturday at 12. Okay, next week I won't be here. But I'm excited to have come so far through the year for all of us to be here together. Suji Ogudeji, my brother, he's the only person that I know would always own whatever compliment you give him. He will say, yes, I know, thank you. I think we all should be like that instead of saying, don't mention, no, it's not a big deal. It is a big deal. I appreciate you guys and I'm glad that you know. So, all right. This is the last episode for the year, and we're still on this very important topic, talking about children's mental health. And today, even though it's like, why are we talking about trauma? It's Christmas. Why are we talking about trauma? It's a holiday period. It's a jolly, holly season. But we really cannot complete the series about children's mental health without talking about this. I just want to highlight this very important topic for all our viewers, and I hope that getting this information, it's not only going to help our family, it will most likely help another family out there, a child out there, a future out there, even future generations, with us knowing about what the types, effects, and of trauma and how we can support children. And you'll be wondering, why am I here alone? Unfortunately, my guest couldn't make it. I got a message from her this morning that she's not able to join us. I really wish you met her. And there'll still be other time to meet her. She is a dynamic advocate for children, and someday you're gonna meet her. So unfortunately, she couldn't make it. So here we are. We're going to make the best of this time. Thank you to everybody watching. Please, if you're just joining, say hello. I would like to acknowledge you. Uh, so I want to start by talking about this study. If you haven't heard about this study before, please look it up and spend some time to read more about it. In fact, you can print out and you assess yourself, or use that the questionnaire. You just use it and see how many of these things that you check on how many of the questions would you answer yes to. The study is called ACE study. It's very popular among those who deal with who work with children. It's the Adverse Childhood Experience Study. This study was conducted, I think we got their participants between 1995 and 1997. And it's a study that had 17,000 participants, more than 17,000 participants. It was done by Kaiser and CDC, just bringing adults together and asking them questions. There were like 10 questions they asked them about their childhood experiences. And this study wanted to know about physical, sexual, and emotional abuse or neglect, either physical neglect or physical or emotional neglect. We wanted to know also if a child grew up in a household where there was somebody that had mental illness, or if this child has been exposed to, if they witnessed any kind of violence before, or if they had somebody that was taking alcohol in the household, and also wanted to know if the child grew up with some in a household where they had somebody that was incarcerated. So this study, surprisingly, more than two-third of 17 more than 17,000 participants answered at least one yes to one of these questions, and we have more than half of them that answered like yes to three or more of these adverse childhood experiences. And the interesting ones that I want to really point out was that the question about, you know, 28% of them answered yes to being physically abused as a child. Then we had 21% of them that answered yes to being sexually abused as a child. Now, the interesting part in the household, 27% of these participants said that they had somebody that was taking alcohol in the house. And the one that I believe a lot of us don't focus on, that I've mentioned several times during this series, is that 23% of them answered yes to having lost a parent to either separation or divorce, not even death, separation or divorce. 23% of them answered yes to that. The lowest number was those who had somebody that had a member of the household that was in jail or in prison. But the one about the separation and divorce, a lot of parents or a lot of adults do not see this as an adverse childhood experience, but it is. And that's one of the ones that I want to highlight from the result of this study. 23% of them answered yes to that question. And now here is the interesting part. The studies have shown that the higher your number on this study, the higher the number you have, whether one or two, the higher your likelihood of having a negative health outcome. And in fact, the study even showed that more than those who have higher scores on these ACE studies or on the ACE questionnaire, they have a high they have a higher likelihood of having more than five of the 10 leading causes of death. So it's not just the behavioral outcome, but the physical outcome, the negative physical outcome, including COPD, diabetes, lung respiratory issues, heart disease. And for a child or an adult that answers four or more on the ACE studies, they are 12 times more likely to commit suicide or to die by suicide than a child that did not experience an adverse childhood experience. So this is a very powerful and significant study. This is a study that, just by you answering this question, a pediatrician can tell what the likelihood of the child's health outcome would be as an adult. So all these things, when we're talking about what is really in childhood, why should we focus on a child's mental health? I'll tell you why. Because whatever is happening to them at that time, that their brain is still developing, is so significant. And in this study, part of the results is that as their brain is forming, it does not only affect their brain structure and as it's growing, It also affects their immune system. It also interferes with their hormonal system. So it is not a joke. It is a very important issue when we say, let's talk about children's mental health. Children are seeing things, children are experiencing things, and as they're experiencing these things and growing up, it is forming their brain structure. So it affects how they respond to stress. It affects how they are it affects how they respond to stress. It affects how their health, physical health outcome. It affects even their decision making, because as this they're being exposed to these things is affecting their frontal lobe, which helps with the impulse control and executive decision making. It affects their amygdala. It affects all these parts of their brain. So when we're talking about anxiety, when we're talking about depression, when we're talking about all those things happening, and how an adult will turn out to be, we need to go back to their childhood experiences. So, what are these different types? For us talking today, let's talk about the physical, let's talk about the emotional, let's talk about the sexual trauma. We have the verbal as well, based on which category do you fall into. A lot of children are going through sexual abuse. This is something any parents would hate to acknowledge or know, or to even discover that it's happening to their child, but it is out there, and we have to pay attention and protect these children. A lot of times, when if we'll focus on prevention, if we focus on something not happening just by putting some things in place and being more involved, then we can save a child from even having to experience or go through that. Another one is verbal abuse, which, in fact, a lot of parents are the ones even doing this to their children. The yelling, And as I was preparing for this, I was checking myself, which I do a lot when I'm talking about any topic here. Because it's easy to talk about it, it's easy to tell people, but it's not easy to see yourself. It's really not easy to internalize these things. I don't know if you can hear it's raining and there's thunder, and I feel like I should be under my duvet. I love rain. I love rain. But uh, if you're not hearing it and it's not disturbing the audio, that's great. If you're hearing it, just I'm trying my best to make sure that it's not interfering with what we're talking about. So, as I was saying, the verbal abuse. The verbal abuse, the yelling on children, it is not something a lot of parents think. I mean, in some culture, it's the norm. We do this thing, and if you look at it and think about it, your parents did it to you. That's what you know, and we are doing it to our children. And our children will do the same to their children because that's what they know. If it's the physical inflicting pain, the physical abuse and all, there's a tendency that if it's been done to you, that's what you will do to someone else. And so relate that also to having been sexually abused. And when we see all this, teenagers, or we see adults that are messing with children, they probably also had that happen to them. So as we think, okay, this is the way it's been done, this is what's always happen, and this is what we're also going to do, we need to really check our behaviors as it relates to what we're doing to our children, and be mindful that this is going to continue to the coming generation. So the physical, the verbal, the emotional abuse, you know on I want to put this emotional abuse on neglect, and I would relate this to separation and divorce in families. you know when a parent dies, it is a big deal to a child. And I think when that happens, a lot of people say, oh, this parent is physically no longer there, and they kind of recognize it as a traumatic experience, and people try to support a child when the parent is physically not there anymore. But let's talk about the parent, the thunder. Let's talk about a parent that is physically present but not involved in a child's life. Or when a child has always known both parents to be together, and for whatever reason they have to separate, or for whatever reason they have to divorce. And when I talk about separation, sometimes it's just even a parent going somewhere else to work. It's just even a parent being transferred out. The separation doesn't have to be as a negative one. It doesn't have to be something that is okay, maybe permanent. But you see, that experience of a parent not being available for a child, it's significant in every child's life. And that's where we talk about military children. This is where we talk about children of politicians. We talk about children of top executives that their work requires them to travel a lot. That their work, either the mom or the dad had to be physically away from the child or from the parents for a prolonged time. It is one of those things that it's traumatizing for a child. And when we talk about the solutions and how we can help, I would talk about how we can handle these things. But if we do not recognize these things as being traumatic, or we don't recognize them as being significant issues in the life of a child, then we thank you, DJ, as this is so nice to see you. Thank you. Said, yeah. So when we don't see these things as a big deal, we don't even think it's necessary to intervene. So let's think about these things and see which one is affecting, or which one relates to me or to my sister or to my in-laws or to my uncle, or that I'm doing as a parent myself, and how can I support this child. So I talked about the sexual abuse. A lot of parents don't know this, but we have to acknowledge it and work on preventing it, putting measures in place to help our children. Do we have an elderly person in the house living with the children, an uncle, an auntie, a neighbor that will leave a child with? We need to know these things are happening and stop pretending like they're not happening. And every one of us should also know, hey, this should be a concern of any parent. So when a parent is trying to put measures in place, don't blame them. There was a time, one of my in-laws, requested that I always want to have the kids around me. When I still have them now, some of them are in college. I have to even beg them to call, or to say hello to me. But then when they were still younger, I would ask my brother, ask my in-laws, can the kids come play with me? So I take them out and stuff. I remember the day that my sister-in-law told me, Dio, I'm putting these children in your care. Please, I am not giving you any permission to let them go to any other place other than your house. It sounded kind of like, oh, why did she say that? But I quickly caught myself and said, yes, that is what she wants for her children. These are daughters and a son. And she's telling me they are in your care. I'm not giving, she told me expressly, I am not giving you permission to let these children go anywhere else than your place. And don't put them in any other person's care. So I remember that, even though I wasn't going to take them anywhere, but her saying that is her being proactive. Because yes, I could have just said, oh, you know what? My brother is coming and I can just take them there and keep. She did not want that. So this kind of things, we have to take them seriously and put measures in place. So two ways. As a parent, please put these measures in place, remind people, let there be boundaries. Now, as you being on the receiving end, in case a parent says that to you, in case a parent says, don't call my child your wife, or don't call my child your husband, or don't put my child on your lap, or don't even put parents in a position to say that. Let us all, as adults, make this thing a norm in the society, so that by that doing that, we safeguard the children from everyone. So it's a norm. Let's all know, don't mess with teenagers, don't play with their breasts, or don't play with a boy's genitals, saying, hey, you're a big boy now. Don't do that. So let's put this kind of things in place, because sexual abuse is real. And for parents, because I have seen and I've heard, I mean, I have a patient, or a set of patients, that it's their mom's in-laws somewhere, that they were living in the house together, abusing these children sexually. So to just wrap up the sexual abuse part, I want to say it is real. It is happening more than we would like to admit. So let us prevent it. Let's put measures in place, and don't take offense when a parent is protecting or setting boundaries for their own children. And for other people's children, please also help them set boundaries wherever you are. That's one. The verbal abuse, parents do it a lot. Let's be mindful of this and start thinking, are there other ways that I can talk to my child, or correct the behavior, or find out what is going on with my child other than yelling? That's one. Then the emotional abuse, when things happen, separation, divorce, the loss, changing of school, changing of environment, all those things, let us also pay attention and know that these are things that can affect a child. Okay, and the neglect part, when we don't take care of what are they going to eat, when we don't pay attention to what would they wear, when we take for granted, where would they play, when we take for granted the fact that they want to engage with their friends, or they want to have some things in place, it's it emotionally um affect those children. And if you think back at your own childhood, you know how many times maybe some things happen to you that somebody took for granted as an adult. So let's be mindful of that. Now, I talked about the separation, I talked about the physical abuse, I talked about one. The other one I want to talk about briefly is when you have somebody that has a mental illness in the household. It might be addiction to alcohol. It might be someone with depression. It might be someone with schizophrenia, and they're behaving in ways that a child do not understand. You have someone in the household with a mental health issue. This is an adverse childhood experience for children. And I want us to call it this so that we can pay attention to it and know that we need to protect the child. You might have to do a little bit of extra stuff, explaining things to this child, protecting them however we can. If they can stay somewhere else, if the mentally ill person, especially if it's chronic, and if it's manifesting in ways that can really affect these children, let us find ways to protect the child. Let us find ways to protect the children. It affects them. And talking about, okay, if we know, and I want to quickly say this. I don't want us to think of children only in the nuclear setting. I know a lot of people watching me, you probably have your family, you have your family, your nuclear family, you have extended family, you have cousins, you have, nephew, nieces that you're able to relate with. But I want us to think of ourselves outside of that context a little bit. Let's think about children who would be adopted. So if you're a parent adopting a child, you want to be mindful of this thing. A child might have gone through some of these things before they get to you. So how do you help? How do we support? In churches, you have children coming from different backgrounds, from different households, and you see them behaving in certain ways, a lot that you don't know, but you are there in church or in a mosque or in a religious setting, you only see them on Sundays, and you're seeing some behaviors that are disturbing. I want you to have at the back of your mind, you really don't know what those children have gone through or are going through in schools, as a teacher, as an educator, as a principal, as a proprietress, as, a janitor, as whoever you are. in anywhere that you see children, you have to know this thing so that you're putting it in proper context. So I don't want us to see it just as talking to parents for their children. I want us to see it that it might even be you in a position to make a change. It might even be you in a larger place other than your own family or your own children. Let's think about it in that context so that we're able to help those children. So I want to quickly say, what are the things you will see? So if we're talking about children that are not your children or even your children, what are the signs? What are the things to look for? There's so many things to look for. But let me talk briefly about the common ones or the ones that you really don't want to just ignore. Part of it, the change, as we talked about with my guest yesterday, a change either in their behavior. An outgoing child suddenly starts withdrawing. Or let's even talk about, little children. They're crying uncontrollably and they don't seem to be nothing seems to suit them. You want to watch what is really going on. You want to pay more attention and maybe do a little bit of investigation and monitor more closely. A child is can be consoled, or a child that has been talking before is becoming just mute, or a child is not sleeping well, complaining of nightmares all the time, or a child that has stopped bedwetting starts to bedwet. A child that has gone through some developmental milestones just starts regressing, like a child will just start sucking its thumb. A child will just start sucking his or her lips. They don't used to do this anymore. Or a child that is like 7 years old start talking like a baby, or start acting like a baby, or start pulling on themselves, or start just doing things like this is weird. Don't just hit the child. Don't just say, what the heck is wrong with you? You are no longer a baby. When we start seeing this pattern, let's think, what could be wrong? What could be going on with this child? And then withdrawing from friends, not doing what they used to enjoy. A child loved to paint, no longer interested in painting. And it's not as if something else, another game, another interest is taking that the space of what they used to like. You want to watch, what is going on? Or a child is sleeping too much. When they're growing up, they're sleeping too much or they're not sleeping at all. Or they keep complaining of physical symptoms. It's headache today, it's tummy ache tomorrow, it's leg pain tomorrow. You go to the doctor, they can't really find anything. But they keep somatizing, like whatever is happening to them, sometimes they convert it to a physical issue. A lot of men do that too. Instead of complaining of feeling depressed or anything, the men would rather complain of having a headache or, they can just convert. Children do this a lot too. They start complaining of physical symptoms, but it might really be something more than a physical symptoms that physical or medical issue that is going on. So when they start withdrawing, you want to watch that. When their grades start failing, you want to watch out. What is going on? They start becoming very disruptive. Like for example, a child just starts misbehaving. A child just starts becoming aggressive, and you're like, "This is not you. You used to be more calm. You used to be loving. You want to pay attention. What is going on with this child?" Or a child just suddenly starts freezing. You call their name and they freeze, or they're slow to respond, or they start having fear of something that you're like, this is crazy. When did you start becoming afraid of yellow spoons? Or when do you start becoming, when does broccoli starts looking like a monster? They come up with something, unfounded fears. You're like, where is that coming from? You want to watch out and see, could something be happening? And to children, say between like 12 and 17, you find out that you're smelling something in their room that's smelling like drugs or smelling like something that shouldn't be in their room, or they want to start taking alcohol, or they come home, they're smelling of alcohol, or they start becoming disrespectful, or they start skipping classes, they don't want to go to school anymore, or they're talking about feeling guilty for something they've done. I feel so bad. I think mom and dad separated because of me. It was when I came into their life that things went down the drain. Or um they're talking about being hopeless. They're talking about maybe giving their things away. They no longer want to just be involved in what they used to do. They no longer want to relate with friends. Or they're staying in their rooms for hours. Or they just no longer want to be in the house. Or they're complaining of nightmares or having sleep troubles. You see them up all night. Or you see them, they start acting weird. All those things are like red flags or concerning flags. They're things calling for attention. They're telling you something is going on, they need help here. How do we help them? How do we help children? How do we help children that have been exposed to traumatic events? How do we let them know we're there? How can we make the outcome better? How can we prevent such from happening? Well, I would keep it simple and just say the first thing we need to know is not all child would react the same way. Children have different ways of responding or expressing their chronic stress, of expressing their traumatic events. Some children can get like really creative and start drawing. They try putting all that's happened to them. Like you're like, why are you drawing this dark stuff? Or why are you doing this? They express it in an artistic manner. And you see some children would just shut down. They will just go mute. Children respond, react, express traumatic events or their concerns in different ways. So, one, it's not one size fits all, but you need to pay attention in whatever setting you are, either in your own household, in your family, in school, or with a child you just adopted, or with a foster child that you have, or with just maybe a child that happens to be living with you. Like maybe they're going to school in your town and now they're living with you and you become the parent. Whatever situation puts you in that child's face, know that children respond or react to traumatic events differently. That's one. So knowing that means you acknowledge that yes, something might be going on and you want to pay attention to this. The second thing is find a way, instead of shutting them down, instead of telling them how to feel, instead of putting your own experience on them or saying this is how you should behave, or telling them you're not the only one that this happened to, or tell them if I told you what I went through, you would know that you're having it good. Instead of telling them and putting all those things with them, find ways to help them express what is really going on. Find ways to explore what the issues might actually be. So acknowledge it that these things are happening. This thing might be happening and children will react differently. Two, find a way. Really spend time to help them express what they're going through in a non judgmental way, with you wanting to help and not wanting to judge and not wanting to just get that secret out of them and start using it against them. Let them express themselves. It goes a long way to be able to express themselves, because it is in that expression that you're able to know, okay, maybe find out the roots of the issue and then find the appropriate help for them. Help might be as simple as changing the location. Help might be as simple as putting boundaries. Help might be as simple as asking someone not to come to your house again. In the case of sexual abuse, in the case of emotional neglect or emotional, it might just be something simple to make the child feel safe again. But you need to be able to get out what is really going on. So help them express what is going on. And for those who are maybe grieving a loss, a separation, a death of a parent, or a divorce of a parent, let these children also express their grief. Children grieve. Let them let them know it's okay for them to really express what is going on with them, to be able to feel bad for something that has happened, or to be able to mourn a loss and process it so that they can come out healing, they can come out better, not just wanting to fit into the box of this is how a child should be and this is what a child should worry about because there's an adult providing everything for you. That's not healthy. And then the last thing I will say is as a family, you need to be able to, let's try to be able to deal with stuff together with that support as a family. So this also goes for adopted family. This goes for foster care. This goes for, those in orphanages. This goes for children, even in school. Like when we talk of a family in school, the family could be, hey, someone has gone, is a child is went through this before coming to our school, or a child is going through this at home, and then we create that environment that makes the child fit in and help them deal with or distress from everything that is going on. If it's a nuclear family, that's something that happened, you're just finding out maybe a child was molested, or you're just finding out this happened to this child as this child was neglected, or you're finding out this child's dad or mom is not even involved in their lives. All those things that you're finding out, like, okay, this child is now having alcohol issues or drug dependency issues, all those things. The issue is there. Then let's now help come together to see how we fit in to help this child. Why do we need to do all those things? Because these children, just like I've grown to become the adult that I am now, and I have children, whatever has happened to me, somehow it's going to go down back to my children. I've either healed and be able to process it and see how I can do better, or I'm hurting and I really don't know how to help another child in my care. So I would only be given what I have. In essence, helping children now, either at the prevention stage, keeping them safe, or at the intervention phase, dealing with what is happening with them, acknowledging it and helping them, or either at, the treatment phase, because for some people, it has even gone beyond what we're saying. With the ACE study, there's a high likelihood of those who have been exposed to one or more, or is it two or more, there's a higher likelihood for them to have drug and dependency trouble. There's a high likelihood that they're going to have behavioral problems. There's a high likelihood for them to die by suicide or attempt suicide that a child that did not have this. There's a high likelihood that this person is going to be a violent adult. There's a high likelihood that this person is going to perpetrate even more of the harm that they experienced as a child. So, children's mental health is so crucial. Children's mental health is so important. I would say start with yourself. If you can download the ACE study questionnaire, download it and see how many did you check out for. And by reading that questionnaire, then see how can you make sure you either protect your children, future generations from experiencing the same. You're having marital issues in the house, you have to consider how is this affecting the children and how are we going to support the children. Because these children are going to become adults, they have to deal with another generation. Will they be passing on healing, or will they be perpetrating the hurt? What would you do? What would you do? We can do a lot. Start with yourself. Look at your family, your children around you, and then look for opportunities to share this kind of message, to put caution in place, either with family, friends, in your neighborhood, in schools, with policies, you're even at work, in churches, in schools, so that we're truly, truly helping future generations, so that we're increasing mental health awareness, so that we are decreasing the stigma associated with mental illnesses. We can all do something. So I hope that I've been able to pass the message across to one person, just one person, you, and just one person, me. Okay? I always put myself in this state. So if there's anything you would like to add, did I miss anything? Is there something else you like? Oh, and this one too. Please put in the comment. Please put in the comment, because I'm not able to cover everything. So I just picked out those very important ones, and easy ones to spot. They're all around us. Sexual, physical abuse, verbal abuse, neglect, separation of parents, so crucial, and having a family member with a mental illness. So, all right, so that is it. Is there anyone that you think should hear this, should listen to this? Tag them. Is there anyone that should know about this? Just say, hey, go to 20 minutes and stuff, and let's just share this. Let's spread the good news. It's a good news this time. It's a season of joy. It's a season of merry. Let's also share this, because this is good news. Really, it's good news. Knowing this thing, it's good news, because it's not only for us, even future generation, the generation yet unborn will benefit from a mother, a father, an uncle knowing this information, because it makes all the difference. Okay? To everyone who joined and everyone who will be watching the recorded one, I say thank you. Thank you so much. It's been a wonderful year. I have learned so much. I have learned so much, and I hope that you've been able to learn something too. Now, beyond learning, I've been able to put a lot of things in place. I've been able to implement little stuff. I'm still trying. I'm trying. We all are still trying. Mental health is not the only thing. We have mental health, we have financial health, we have physical health, we have so many things. But mental health wise, I've learned a lot. I'm putting a lot of things in place, and I hope that you are putting out your own best effort too. It's been a great 2021 here in the group. So thank you all for watching. uh, Team Mode, thank you for joining. You said, yeah, you're just joining. You missed a lot, but you try to watch the replay. I'm sure that this is going to help all of us, all of us. So thank you everyone who joined. DJ Aziz, Tunji Ogundeji, to Jezba. Thank you so much for always joining. DJ Aziz, you're the best. That's the best DJ in the whole wide world. To me, he's the best. Okay, so and he can go anywhere. So if you want DJ, if you want your party to be the bomb, you have to call DJ Aziz. Thank you for being a great member of the group. Suji Ogundeji, the Ogundejis, they are wonderful people. Bukesco, thank you so much. TJ, my niece, he's also always asking me questions and stuff like that. Thank my nephew, thank you. To all the members of this group, to all the guests that I've had this year, I say thank you so much. So I'll be having my thank you message soon, someday soon, and to everyone who has implemented or taken a step beyond just listening to this and doing something, even if it's just telling someone else, hey, I learned this. How about you try that? Thank you. So until I see you next year, I think I'm going to let you know the date that I'll be back. But I'm also taking a break from the live shows, and I hope that you have a wonderful holiday. Okay? Until then, my mental health matters. Children's mental health matters. I want you to also prioritize your mental health. Have a happy holiday. I'll see you next year. Mwah! Okay, the broadcast doesn't want to end. Okay, bye.